Thank you for joining us on GBMC's Facebook page. I am your host, John Lazarou. We're going to be holding 3 interviews today, this one being the first that's going to provide our viewers with some valuable information during these unprecedented times. Additional information on our segments will be provided later on this show. For now, we're going to be talking about mental health and the fears of diagnosis during COVID-19. There are millions who are facing new or rising diagnosis of depression and anxiety. This pandemic has taken a major toll on everybody's mental health, especially those that are already dealing with mental health issues, and even those that are not normally accustomed to anxiety or sadness. Joining us today to talk about mental health during COVID-19 is GBMC's Chief of Emergency Psychiatry, Dr. Anthony Chico. Dr. Chico, thank you for joining us today.
Good morning. Thanks.
Good morning. So we talked about, the mental health during COVID-19. Let's talk, a lot of people, of course, are quarantined at home. Some of the people that used to go to work are not working now. We have people that used to run businesses that can't open their doors. So there's a lot of things that are going on with regards to mental health. However, let's start with this simple question. What are some of the main types of mental health concerns that you're hearing from your patients during this time of quarantine, or people that maybe are dealing with mental health issues for the first time?
Yeah, certainly we are in a unique time, a time that I don't think any of us have ever experienced. In my own practice, I'm seeing a wide variety of things, primarily anxiety, depression, sleep difficulties. But by far, anxiety is the most prevalent thing that I'm hearing from patients. And it's not a surprise. When we step back and we look at the idea of what anxiety is about, oftentimes the general concept is we're in a situation where we feel we have little control over it. And right now with this virus, it's a situation where we're fighting an invisible battle, and we're fighting a battle on a timeline that's uncertain. So those two variables really make this a challenging time for all of us.
So, Dr. Chico, what are some ideas that maybe we can take into account, or some advice you might have for us in taking care of not just our physical health, but also, let's say, our mental health, right? A lot of people say, go out, get some exercise. Yeah. That just doesn't help you physically, but it also helps you mentally, sure. Which is still allowed, by the way, despite all these rules and regulations, that are put in. But what are some ideas that we can take care of our mental health and finding some comfort amidst this whole pandemic?
Some of this you may have heard from others, but it really starts with trying to reestablish a sense of routine, like you mentioned earlier. We're not at work, we're not at school. Our predictability of our day has been turned upside down. So I oftentimes it starts with trying to regain a sense of pattern. A lot of times people ask me, what's the point of therapy? What's the point of seeing a therapist? And a therapist is really someone who helps us recognize patterns in our lives. So starting out by trying to have a schedule, whether it's our sleep routine, our eating routine. A lot of our children now are learning through their computers with their teachers. So, as best as we can, trying to establish some routine is number one. Number two, in doing so, it's important to diversify our day, not locked in a room on a computer all day. Scheduling times to take that dog for the walk, or making a meal together as a family. It's important so that we don't feel isolated. There's a lot of talk about social distancing, which is important, obviously, from an infectious disease standpoint. But social distancing doesn't equate to isolation. Isolation, from a mental health standpoint, creates a ripe environment for symptoms of depression and anxiety to grow. I have found in my own community that we actually seem to have grown a lot closer. People are going for walks, appropriately spaced apart, but helping where we can, grabbing extra groceries for an older adult. If you're a teacher or a college student, maybe helping another kid in the neighborhood virtually with their homework. Giving us a sense of purpose is another way to navigate this. And at the same time, trying to limit the media that we take in. A lot of times, media is rich in theories and thoughts, but kind of lacking in hard facts right now, because we're still learning this, we're still developing. There is some silver linings, though. How often do we say, I wish I had time? Well, we have time. We have time to do things. When we take vacations, we're usually scrambling around trying to get to the amusement park or book this or visit this person. I actually have time to get to know my kids for the first time in a long time.
That's important. We're going to get to that in a minute. Joining us today, again, is Dr. Anthony Chico, Chief of Emergency Psychiatry at GBMC. Dr. Chico, you mentioned children. You mentioned spending time with them.
Yeah.
I got to be honest with you. This past weekend, we watched a movie with the kids. I can't remember when was the last time we actually all sat together on a Saturday night and watched a movie. But I want to go to children. I mean, it's fair when the parents are home, okay? But we talked before the program today. Yeah. We both have kids around the same age. Mm-hmm. We're here at work, they're home alone. So what are some of the tips you can provide to kids as well as parents on helping them with their mental health, not just being at home and finding a purpose, but dealing with each other? You know what I mean? Because as you know, even on a good day, siblings can get on each other's nerves.
Sure. Well, like adults, kids need structure, right? They need predictability. We need to help them with their routine. Something as simple as who gets to get on the computer first or the Xbox, divvying up time, giving each child a role. I need you to help me with this. We all want to feel needed. We all want to have a sense of purpose. I think establishing with the kids and doing this as a family, not necessarily dictating, but kind of as a family divvying up the responsibilities. And, teenagers recognize the times we're in are very unique and different. With younger children, that's a different type of story. And I think with our children, regardless of their age, it's important to be honest and open with them. If we're trying to soft pedal it or not be upfront and honest, their trust in us is going to diminish over time, and we really need to keep that established. I think with the teenagers, though, I think having a routine, having some structure, and giving them a sense of purpose. I need help with this. I need you to help your brother with that. You're the expert here. She's the expert there. And I think that can be helpful.
Again, joining us today is Dr. Anthony Chico, who's the Chief of Emergency Psychiatry here at GBMC. For those of you that might not know, Dr. Chico practices psychiatry for both kids and adults, so which is why we're talking about kids this morning. I encourage those watching us on Facebook to please send us your questions in the comment section. If you want to be a little bit more private regarding your questions, please feel free to private message us as well. Dr. Chico, one of the questions that came in before our show that says, during this pandemic, what should someone do if they have an existing mental health condition?
Well, hopefully that person already has an established treatment team. Certainly if they have a psychiatrist, if they have a therapist, it's important to continue to stay in contact with them. I know in my own practice, I'm now starting to resort to phone call sessions or virtual sessions if they're uncomfortable coming into my office. So it's important, again, to maintain that pattern or that rhythm of treatment. Naturally, if you are being prescribed medicines, please keep taking them as prescribed. Also, it's important to recognize that these are times where some of us may be more vulnerable to slip into illicit substance use or alcohol use. And, obviously it's the concern here is with continued use of such products, we can feel more hopeless, we can feel more vulnerable, and those are moments where we can be more vulnerable to act impulsively, where bad things sometimes can happen. So to answer your question, stay in that rhythm of treatment that you had prior to this pandemic.
Okay. One other question that came in is, for those that are quarantined or working from home, which we talked about a little bit before, they may feel even more lonely and isolated. What advice can you offer them?
Well, the interesting thing is our work family, we oftentimes spend much more time with than our own family. So if possible through your work virtually, stay in communication with your coworkers. Obviously you're going to hopefully stay on focus as to what the role of the business is, but it's that day-to-day banter, that support that energizes us. So staying in contact with your coworkers, obviously with your bosses, is important for many reasons.
You said about staying in contact with your colleagues and your bosses, fellow employees and such. There's that fine balance, and we talked about keeping in touch and stuff. We talk about the balance between screen time and the balance between watching TV. However, a lot of people are encouraging during this time to reach out to family and loved ones, with FaceTime or Skype or whatever they're using. How important is that for someone that might be facing mental health issues, or even those that are just feeling the stress of being quarantined?
Yeah.
How important do you think is that for our mental health to reach out to family and friends via those methods?
Yeah, so important. I mean, ideally, what we're doing now in person is ideal, but we have to be flexible enough to know that if we can't get the ideal situation, this is second best. The idea of staying in contact, though, serves the purpose to know that we're not alone. The one, dare I say, nice thing about the pandemic is that we're experiencing it together. This is not something that I myself am experiencing. So we can find comfort knowing that I've thought this, I've felt this, and that's historically when someone is requiring hospitalization for a psychiatric condition, when they're involved in the group activities that many programs offer, it's that group experience that we realize that I've thought the same thing. I'm not the only one. So that communication through FaceTime or Skype or what have you can help foster that sense of community.
Again, joining us today is Dr. Anthony Chico, Chief of Emergency Psychiatry at GBMC. Again, I encourage those watching us on Facebook to please send us your question in the comment section, or if you want to be private, you can private message us as well on Facebook. Dr. Chico, we talked about taking care of others. And we'll get to healthcare workers in a minute because, of course, they're one of the populace that's facing this as much as anybody. However, I want to talk about caregivers and those that are taking care of people that might maybe a little bit older, younger, whatever, but might have some mental health or anxiety issues. What advice do you have for those people, the caregivers that are taking care of a family or a friend or a loved one that might have some mental health or anxiety issues during this time?
Yeah, well, we're thrown into roles that maybe we weren't accustomed to. Maybe you weren't that caregiver prior to this. And if that's the case, it's important to try to reach out to other family members that may have spent more time with that loved one that can give some inside tips or tricks that have helped that individual through other hard times. But again, whether we're talking about children or older adults or people with disabilities of various sorts, it's trying to help guide that person in finding some type of predictability or structure to their day. The caregivers sometimes need a little extra guidance through their own network of other providers or family members.
We had a question that came in from Douglas, and Douglas says, I have depression issues and took off work yesterday and today, but have to go back tomorrow. I just feel depressed and afraid I may do something irrational. What can I do to avoid that thought process?
Okay. Well, thank you, Douglas, for that question. And I think at times a lot of us will have various thoughts and concerns that float through our mind. And I would encourage Douglas, depending on the severity and the nature of the thought, to sort of walk through a checklist in his mind as to, number one, who closest to him historically has been his rock, who he might reach out to. I would start there with a familiar individual. A lot of times when a person's going through depression or anxiety, whether they're getting better or getting worse, we ourselves are the last ones to fully appreciate that. It's the people closest to us that can, from an outsider's vantage, can help us in terms of our progress or lack of progress. So I would first encourage Douglas to talk to his close friends or families as to what they're seeing, what they might have noticed. Secondly, if it seems like these thoughts are becoming more persistent, more consistent, I would first reach out then to our primary care physician or whomever the care provider has been. And then from there, we can go into more specialized services and support. Naturally, if these are more fast-acting acute symptoms where we're truly feeling unsafe, then reaching out to services such as Baltimore County Crisis Response Team, your local walk-in crisis center, or even your local emergency department if need be. There are services there to help you catch your breath and develop a plan to move forward.
I'd like to mention those services again towards the end of our program before we finish today, so please keep those in mind because we are going to come back to it. We had another question that came actually from, I guess, someone that we consider a professional colleague. Jocelyn says, I am a therapist and have been working with teens that are having suicidal thoughts via telehealth. I have been teaching patients strategies to work with them to prevent hospitalization. Is there anything else I should be doing?
Yeah, that's a really new challenge for healthcare providers because, we're not in the room. We're not there to fully get a sense of where that person can be at times. I think it's important that if with your clients or your patients, you need to clarify with them the significance of these thoughts, the persistence of these thoughts, the struggles with possible intentions of self-harm. We need to establish that, whether we're talking about children or adults. With children, though, if we are faced as a provider in a situation where there is a concern of dangerousness, there are difficult times where we have to breach that confidentiality and reach out to their family to ensure that that child is safe. So with telehealth, there is a little bit more of a barrier there, a little more of a challenge.
One of the methods that I read before we had our show today talks about meditation visualization. How important do you think that is, not just for the adults, but also maybe for children and even young children? And what are some tips when you come to think about meditation visualization that will help during this time?
Well, meditation, visualization, like any technique, takes some practice. So I would encourage people that, as you try to begin the process, if you've never done this before, be patient with yourself. It doesn't just happen right away. It takes practice and routine. I think it's a challenge for a lot of us initially to try this because we live in such a fast-paced world up until this point that learning to be alone in our own thoughts is a foreign concept. So I would say start out with some simple things that might be familiar with you. Just going for a walk without the headphones on. Taking time to look at what's around you. And then maybe if you are having a thought or something, when you get home, take the time to write it down so you can look at the patterns of these thoughts. Sometimes we see people do meditation and they seem so relaxed, and for some of us who haven't practiced that can be kind of mysterious. Right. I would just approach it initially in a simple manner.
And maybe meditation visualization will help someone like Stephanie, who sent us a question saying that I am pregnant and with all that is going on, my anxiety and depression has gotten worse. What are some steps I can take to better cope?
Well, congratulations that you're pregnant. Certainly if this is your first pregnancy, in and of itself comes with its own excitement, but also anxiety. Being pregnant or not, though, some of the things I mentioned earlier about, trying to build in some rhythm and predictability to your day also applies to yourself. In terms of the progress of your pregnancy, obviously knowledge is powerful, so there's many free websites where you can kind of track if you're having certain physical symptoms or signs that kind of will give you benchmarks along the way of how you're progressing. So, and I'm sure there's a multitude of family members that have their own advice that they want to share as to their own previous pregnancies.
Joining us again today is Dr. Anthony Chico, Chief of Emergency Psychiatry at GBMC. I want to thank everyone who's watching, who sent in their questions. We hope that we're providing you some valuable information regarding mental health during this coronavirus epidemic or pandemic that is going on. Again, I do encourage everyone at home watching, please send in your questions in the comment section on our Facebook page, or you can private message them if you want. And do know that today's interview with Dr. Chico will be available on our YouTube page and also our Facebook page for viewership later on, either today or tomorrow. So please keep that in mind. Dr. Chico, before our program, we talked about, losing a loved one. And we talked about, when someone passes away from a heart attack, it happens, and it's an unfortunate incident, but it happens, and families try to move on after that. However, what are some suggestions you might have for those that might have lost a loved one, or even caring for a loved one that has been diagnosed with coronavirus?
Yeah, so regardless of how our loved one passes away, obviously there's loss, there's grief. The challenges in this situation is that I can only imagine if you lose someone to this virus, unfortunately every day, all day, we are being reminded that this virus is taking lives. If someone's dying of a heart attack or a stroke, we're not getting bombarded with that every day, all day. So I think it's important for families to try to step back from the intake of that media as much. Being close to our loved ones, having that connectivity during times of loss is so important. So unfortunately right now, for many of us, it's only through computer screens. I would suggest that people consider starting the planning process, that in the coming months, as a family, can we establish a memorial ceremony, a celebration of life of this individual, so that we'll be able to properly find closure to that loss that unfortunately right now has just occurred.
Another question that came before our program today is, any advice for clinicians that treat the mental health of pediatric patients and even adult patients amid this outbreak?
Yeah, so like I said earlier, I think what is unique about this situation is whether you're a psychiatrist, whether you're an ER physician, whether you're a pediatrician, we're all in this together. We're all experiencing similar risks, similar concerns and fears. But with that shared experience, I see as a positive thing. I think we have to remind ourselves why we went into this business. That we're in a business where we want to make a difference. We want to help people. So, this is one of these rare opportunities where we have a chance to shine and try to help. I'm very honored as to the work I see in this emergency department over the past couple weeks. No job is too small. Everyone is pitching in. There remains a sense of positivity, which can be infectious in and of itself. So I think it's important that whatever job you're in, whatever experience you have, when there are people that are also in that experience with you, we need to look to each other to bounce ideas off of and problem solve with, because that's what's going to be most encouraging for us.
Again, joining us today is Dr. Anthony Chico, Director of Emergency Psychiatry at GBMC, who also specializes in children and adults, which brings me to my next question. Is there any data available regarding mental health effects from the coronavirus outbreak thus far in either pediatric or adult patients?
Yeah, that's a good question, and I could be wrong. Obviously, I haven't looked at every piece of data out there. The effects of situations like this from a mental health standpoint tend to lag. So when we look back at the awful tragedy during 9/11, the psychiatric wing of things sort of kind of caught up later down the road. So from a mental health standpoint, I haven't really seen much hard data yet on how people are coping. I could just tell you in my own practice, yes, I am receiving a few more phone calls, just simple, how am I doing, what should I do? But I think the data is still out on where we are as a community.
So, we've talked a lot about certain populations when it comes to mental health, adults, children, of course. We touched a little bit on healthcare workers. We talked a little bit about caregivers as well. However, let's talk about some older adults, and maybe older adults with disabilities. What can they do to reduce the emotional stress and anxiety during this time?
Yeah. Well, when we look at some vulnerable populations like older adults that may struggle with conditions like dementia, individuals that might have intellectual disabilities, this is a very vulnerable population, because any slight changes to routine can be dramatic in their response or experience. So we have to be overly and structured with that population. Looking to other family members, what helps grandma, what music does she like, what foods does she like, what puzzles or games does she like to play, really trying to simplify that routine as best we can for them.
We talked about earlier about people going to work and those that, are now home because their place of work is, temporarily closed and so forth, so on. They're worried about, their job, their paycheck. Now bills are coming because, today's the 31st, tomorrow's the 1st, and the bills are going to start coming in. It starts to pile up, the stress and the anxiety. So let's talk a little bit about those small business owners as well as those that, work in certain industries where they are dependent upon a salary. What are some of the ways that they can take care of themselves? And when it comes to small business owners, not just about themselves and their families, but also their workers.
Yeah, I have many family members that own small businesses. Many of my own patients have called me about their small business. I think when we step back, we all have our own zest and temperament in this world. And when you look at small business owners, entrepreneurs, they tend to be individuals that are used to taking charge. They're kind of in control of their destiny. And right now, a lot of that control has slipped through their hands. So especially they're looking at the bills, but also feeling very uncomfortable that they're not in charge of what's going on. A lot of unique approaches as to how to deliver products, changing up the products they deliver, the communication within their company has changed. A lot of small business owners are reaching out to their professional organizations where they're connecting. Say if you owned a McDonald's and I own McDonald's, we're talking to each other, how do we make this work? So that can be helpful. But just their employees are their families, a lot of these businesses. And they're having to have these very honest conversations as to this is how much money's in the kitty and this is how long I can do this. So being honest with our team is important here.
So we got a couple more minutes left in our show, so I encourage everyone watching us, if you have any questions for Dr. Anthony Chico, please send them in the comment section on our Facebook page, or you can even private message us as well. Dr. Chico, like I said, we got a couple more minutes left. I do want to get to a couple of more questions before we end our segment. So let me, on a personal note, I have to say, working in this hospital like you, the amazing work that's going on here. The frontline providers, the clinicians, everyone, the nurses, everybody that's been involved during these times have done a fantastic job. Despite whatever hurdles might be in front of them, they've been committed to taking care of their patients. And I credit you as well, finding unique ways to take care of those that need your help. But again, for fellow healthcare workers like yourself, those in the ED, pediatricians, primary care physicians, let's talk about it one more time. What advice do you have for them, again, in helping them manage their stress and their anxiety?
Well, it comes down to first taking care of yourself. We've all been there in this line of work where we can run ourselves ragged. It is so important to make sure that you do take a few moments, eat, take a break. It's important to let our colleagues know, I need to step out for a little bit. I think we know each other well enough to appreciate what we mean by that, to gather some strength. We're not going to be helpful to others if we're not caring for ourselves first. It's also important with our families, because our families are at home concerned about us. Are we getting sick? Are we going to bring something home? I know a lot of docs. You get to the door, and nurses, you jump into the shower, clothes are in a bag. There's a lot of concerns out there, and the only way that we're going to get through this is sharing these thoughts together and coming up with plans together. And I think we're doing a good job of that. And I'd also add the community has responded so well in this area. The exchanges that I've had with patients and family members, the amount of understanding, and so I feel that we really are working well as a group here.
Again, I just want to recap before we finish our show today. What are some of the serious mental health concerns that, again, we need to be aware of moving forward?
Well, If someone's depression or anxiety is intensifying, it's important for family members to appreciate that if our day-to-day functioning has broken down to the point where that individual's not caring for themselves, they're not getting out of bed, they're not eating. Sometimes with severe depression, a person can struggle with more intrusive thoughts or irrational thoughts. It's just kind of the nature of the progression. So that person really will need more comprehensive care. That's a point in time where a phone call needs to be made, or that person needs to be evaluated more emergently. So it's really just looking at from a practical standpoint, is this person getting through their day each day?
Dr. Chico, thank you very much. That's all we have for now. If you have any questions or comments, please submit them, and we will try to get to them with Dr. Chico before he goes off and does what he does best. Please note that, again, this was the first interview of 3 today taking place. Our next one will be at 12 noon. We're going to be talking about COVID-19 and those that have been diagnosed with diabetes and how we can help them during these unprecedented times. Again, that takes place at 12 noon. And then we have another one coming up at 1:30 this afternoon as well, where we look at cardiovascular issues and those people that have been diagnosed with those issues during COVID-19. So I hope you join us again at 12 and 1:30 today. Before I close, I just want, Dr. Chico mentioned about the community and all their help, and we are so appreciative and so grateful for everything that the community has done to help GBMC, not just during these unprecedented times, but also in general. And again, we still need your help. Later on this week, we are holding our annual Walk a Mile event. It is our 5th annual event, and the proceeds raised from the Walk a Mile event go towards the GBMC Safe and Domestic Violence programs. And because of COVID-19, we are doing the walk this year virtually. So what does that mean? That means if you register, and you can go to gbmc.org/walkamile, you can become a virtual walker. And, all we're asking is that you walk 1 mile to help us reach our goal of 725 miles, which is the number of patients that our Safe and Domestic Violence program helped in 2019. They helped 725 patients. So please consider becoming a virtual walker. If you can't walk and you want to make a donation, perfectly fine. Again, gbmc.org/walkamile. That'll do it for now. I look forward to seeing you at 12 o'clock this afternoon. Again, I want to thank Dr. Anthony Chico for joining us today. He is the Chief of Emergency Psychiatry at GBMC. I'm your host, John Lazaru. Thank you for joining us.